We have talked previously about the proliferating mesenchyme beneath the surface ectoderm that produces 5 facial swellings around the stomodium, and oropharyngeal membrane, which is a bilaminar structure, ectoderm, oral, and pharyngeal, which is an endoderm, and these are rupturing. This membrane is rupturing at the 5th week in uterine. The development of the palate takes place in between this week 6 to 8, plus 1 week for females. We have a primary palate or primitive palate and a secondary, a definitive palate. The primary palate is a derivative from the frontonasal process from the intermaxillary segment, and the secondary, which is, the medial nasal processes, the intermaxillary segment between the two medial nasal processes, while the secondary palate, the part here, is formed by two palatal shelves that are originated embryologically from the maxillary process. So the palate develops from two primordia, the primary and the secondary palates. This is a coronal section through human embryo at week 7 and at week 8. So the two nasal cavities here are obvious, which have in between a primary nasal septum that is derived from the frontonasal processes, and these both will form the primary palate. You can see also the small, here from these sides, the small lateral palatal shelves, which are derived from the maxillary processes. In the 7th week, we have a large tongue, and we have a oral cavity that is small, so the lateral shelves would grow vertically at the tongue sides, and you can also spot Meckel's cartilage in both sides, which do not provide growth, but it supports the transformation to bone of the mandibular bone. We have also teeth buds in the corners here. 4 teeth buds for the developing teeth, which you'll take next lecture. Okay, so this is 7th week, while in the 8th week of this coronal section, we will see the differences that we have a larger oral cavity and more space. The tongue drops down. Here you go. Again, you can see the same teeth buds. The tongue will drop down, and what we have is a initial contact of the lateral shelves that grow here in a horizontal direction. Here is week 7, week 8, and week 9 of in utero. So the coronal sections here show me the embryos with initial disposition of the palatine shelves on each side of the tongue in week 7. And week 8 we have depression of the tongue, thus elevation of horizontal palatal shelves. In week 9 we will have a full contact. After the approximation of the shelves, we'll have a full contact. See the vertical growth, the horizontal growth, and the full contact here. At week 9 we have full contact of the two shelves. We have spoken about the formation of the upper lip. The primary palate will begin to develop in early 6th week in utero. The deep part of the intermaxillary segment, as the median palatine processes, will form the premaxilla. It fuses with the developing later on secondary palate. The primary palate represents only a small part lying anterior to the incisive fossa here of the adult hard palate, behind the incisors. The secondary part is the remaining of the hard palate and the soft palate also, with the final part which is the uvula. This is in week 6. You still see the two median palatine processes and the lateral palatine processes that will move vertically, then horizontally, growing till reaching final shelf fusion. The secondary palate is the hard and the soft palate posterior to the incisive fossa. It begins to develop in 6th week from the internal aspect of the maxillary processes as the lateral palatine processes develop. So as a start, the lateral palatine processes will project in a vertical direction, inferior to each side of the tongue, and then with the development of the jaw, the tongue will move inferiorly and it will drop. During 7 and 8 week, the lateral palatine shelves are elongated and they ascend to horizontal position above the tongue. Gradually, the lateral palatine processes will grow medially and fuse in the median plane. They will also fuse with the posterior part of the primary palate. Fusion of the nasal septum with the palatine shelves began anteriorly during the 9th week and will extend posteriorly. Okay, it is completed by the 12th week, where bone will develop in the anterior part, forming the hard palate, and the posterior part will develop as muscular soft palate. This is 7th week in utero. A, the palatal shelves, lateral palatal shelves vertically growing around the developing tongue in B. Same wise, you can also see the in extra the germ buds, the tooth buds that will develop later on. These are the epithelial thickening around these areas, mesenchymal thickening around these areas. You can also see the Meckel's cartilages, which are more obvious here, the Meckel's cartilages, and also the maxillary process and the mandibular process are continuing to fuse together to form the cheeks. What you see here is the secondary nasal septum, or to be more specific, the secondary nasal cartilage, which and the two palatal shelves, which have become in full contact in week 9. At first, you see A is the epithelial seam, which is here, and it is more magnified here, is the epithelial called midline epithelial seam, which will be later on disintegrated as you have a mesenchymal migration to disintegrate the seam. Here is week 9. We don't have yet full fusion of the palatal shelves, and ossification starts of the bones of the palate and the bones of the maxilla. Ossification will start once the fusion is complete. As you can see here, A are the two palatal shelves, C is the epithelial seam, B is the nasal septum, and D are the ossified beginning of ossification, intramembranous type of ossification for the bones of the maxilla, which form directly from the mesenchymal cells without going through cartilage stage. Here you'll start seeing some migration of the mesenchyme to disintegrate and allow for full fusion of the shelves. As you see here, the final fusion of the lateral palatal shelves with the nasal septum here. The formation of the maxilla of human embryo is passed through the developing teeth and the fusing palatine shelves. We can see still remnants of epithelium in the line of fusion. This is the start of formation of the neurovascular bundle in the mesenchyme. Again, this is the migration of this is more obvious, migration of the mesenchyme to disintegrate the midline epithelial seam. So here you will have, if you magnify it, the midline mesenchymal cells in the area of the midline epithelial seam fusing in the area of fusion of the palatal shelves. Here is a higher magnification of the neurovascular process for the palatine nerve, artery, and vein. As you see, here is a coronal section through the developing hard palate. We see showing signs of early ossification. Here, A is the developing body of the maxilla, B is the bone extending from the body of the maxilla into the palate, C is the nasal cavity. As you can notice, the arrow pointing at osteoclastic activity toward the nasal cavity side and a compensating osteoblastic activity in the other side of the oral cavity. Osteoblastic on the oral surface and osteoclastic on the nasal surface to allow for new bone formation and growth in place of the resorbing bone towards the nasal cavity.